This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, welcome into the program. Our guest this morning as we wrap up Heart Month is Dr. Samantha Crites, cardiac imaging cardiology with Mon Health. She joins us on the program this morning. Dr. Crites, good morning.
Good morning.
I appreciate you taking some time. We'll get into the subject at hand today in just a moment. But first, as we always do, we let you talk about you, whether you want to or not, at least for a minute or two this morning. So, Dr. Crites, tell us a little bit about your background. Where are you from? Where'd you go to school? How did you end up with the Mon Health system?
Yes, I was born and raised in Webster County, West Virginia. Came to WVU for my undergrad education, and then went to Lewisburg, where I attended the West Virginia School of Osteopathic Medicine, and then came back to Morgantown, where I did my internal medicine and cardiology fellowship. I started with Mon Health in 2017, I believe. And it just felt like the correct fit for me. It was a smaller setting, more close-knit family, and I just really liked the hospital setting and all of my coworkers, so that is how I ended up at Mon Health.
How did you choose cardiology as a specialty?
Long story short, it started when I was a child. I saw a documentary about the heart and just always kind of fell in love with it. Since then, I always liked studying the heart, looking at pictures of the heart. It just made sense to me, unlike all the other specialties. So it just kind of fell into my lap, honestly. It's just kind of what I've always wanted to do.
Well, we're obviously, February is Heart Month. We're wrapping up Heart Month here. And the topic today is cardiac CTA. Let's start with this. What is cardiac CTA? What are we talking about? So
we're talking about CAT scans of the heart. That's how people in the community describe, a CT scan as a CAT scan. So basically it's a fancy X-ray of the heart, and we can look at the different heart chambers or the heart arteries depending on what we're actually looking at. We do use contrast dye for these studies to look at the heart chambers and the heart arteries. But basically it's just a 3D data set of your heart that we can analyze.
So when you're taking one of these scans, when you're getting these images, what does the patient experience? What are they going to expect during this type of an examination?
So yes, it's a little bit involved. So usually our nurse will call a few days ahead of time to give instructions about the scan. Most notably, we don't like you to eat or drink anything. Don't want you to have anything with caffeine or nicotine. And then a lot of times they will send me a message about the patient, most notably about their heart rates, what their heart rates like to run. For these scans, we like your heart rate to ideally be less than 65 and less than 60 if possible. So if you're, in our computer system, if your heart rate's running in the 80s, most likely I'll be sending you in some medications that you'll take prior to coming to your scan that day. And then once you arrive, we'll check another set of vitals. And if your heart rate is still elevated, then we'll give you some more medications to get your heart rate slower. And the point of that is, the CT scan is super fast. It actually will take the images in less than a second. But for that, your heart needs to be completely still. And so the slower your heart rate, the longer that still period is, so we get better images. They'll come in, depending on what your heart rate is, we may give you more medication. And then during the scan, we will give some nitroglycerin under the tongue to dilate the heart arteries, and then we take the scan. And like I said, the scan itself is less than a second, but it's just all the work up to it. So a lot of times the patients will be with us for maybe 2 hours to get everything, taken care of.
So I was kind of chuckling there. I would venture to guess it might be common that patients may be nervous, that you see some of those elevated heart rates sometimes just get people calmed down a little bit? I would be nervous if I were going in for the scan, I would imagine.
Yeah, and that is something that a lot of people have issues with, especially if they have underlying anxiety. And that will be something that our nurses kind of will look at, and they'll say, they have underlying anxiety. They take this medicine for their anxiety. And if we think it might be a problem, we'll, either call something in for their anxiety or tell them to bring their medicine with them or something like that. But it does happen, but it's actually less common of an issue.
Oh, right. So
yeah.
why would you order this type of scan, and then what would you be looking for once you have the images available?
So there's a couple different. So there's the CTA heart morphology, which looks at the heart chambers and basically the structure of the heart, just the general structure of the heart. Those we're looking, if we saw something on an echocardiogram that didn't look normal, or we're looking at the left atrial appendage or something like that, that is what that scan is for. Most of the time when we talk about cardiac CTAs, we're talking about the coronary artery CTAs. And the purpose behind those is to look for coronary artery disease in a patient that is having symptoms. So if a patient's having, shortness of breath on exertion, chest discomfort, anything that makes you think that there might be some coronary artery disease causing their symptoms, that's when we order the coronary artery CTA. And it looks at, are the arteries coming off where they're supposed to, or were you born with some anomaly? And looking at the plaque inside the heart arteries to look and see if there is any amount of plaque or if there is any significant amount of plaque that could be causing the symptoms.
Dr. Samantha Crites, our guest this morning, cardiac imaging cardiology with Mon Health. How quickly are results available? Will I go in for the scan and then we will meet again later to go over the results, or are we going to find out that day?
You will not find out that day. I strive to get the reports done within a timely fashion, usually within 24 to 48 hours. Sometimes I do get backed up, and it can take up to 5 business days. But most of the time, the results will be in the patient portal within a few business days at most. I usually, when I order these scans for my patients, I will bring them back into the office to discuss the results. The scheduling is about 3 weeks. So if I order you a scan today, most likely it'll be scheduled approximately 3 weeks from now, and then I usually set you up for a 4-week follow-up to go over your results.
And once you've got the results and you've had that follow-up, how quickly then do we get into treatment options or a plan of attack for whatever you were looking for there in the scan?
So when I see you back in the office and we're discussing the scan results, it depends on obviously what we see. So if we see mild disease that's not causing any obstruction, then we're going to talk about your risk factors and making sure that all of your risk factors are controlled, which would be, getting you on cholesterol medication, checking your blood pressure, making sure that it's under control, your diabetes, making sure you're not a smoker, making sure you're eating the right stuff. So we kind of, focus more on prevention and preventing it from progressing. But if we see significant disease where there might be an obstruction and you might need stents or bypass surgery, we'll discuss it at that visit, and then we get you set up for an invasive angiography, a heart catheterization, to look at that closer and then decide if we need stents or bypass surgery.
And I think it's worth mentioning the scans we're talking about today with the cardiac CTA. This is all non-invasive. It's a CT scan, like you said. So on the scale of easy things to do for the patient, this is probably a fairly easy scan. Is that a fair statement? For the patient, at least.
Oh, yes. Yeah. Like I said, it's a little time consuming when you come in. But, if you talk about doing, for instance, a nuclear cardiology stress test, if you come in for that, we're going to keep you probably 2 to 3 hours for that study. And we're going to be keeping you for the CT scan probably about 2 hours at the most, probably. So in that regards, it's about the same time commitment for the patient. The radiation of the CT scan versus a nuclear stress test is actually less. So you get less radiation, and we actually get good images of the heart arteries to see if there's anything going on. It's unlikely that you would get, a false negative with the coronary artery CT scan compared to the stress test, which we do see. So I think it's a better test and for multiple reasons. But basically for the diagnosis of coronary disease, I think it's a better test than the nuclear stress test.
Our guest this morning is Dr. Samantha Crites, cardiac imaging and cardiology, and we'll continue our conversation on the other side of this quick break. You're listening to Mon Health Talk here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Samantha Crites, cardiology and cardiac imaging with Mon Health. February is Heart Month, and Dr. Crites, I say this a little tongue-in-cheek to a lot of the physicians we have on the show. You sound very nice, like a lot of fun, be fun to hang out with. I don't necessarily want to come see you, and I would rather avoid it if possible. So when we're talking about heart health, what are some proactive steps listeners can take to have a healthy heart?
So I kind of alluded to that a little bit when I was talking about risk factors, but making sure that your risk factors are well controlled. So don't smoke, and if you do smoke, stop. Make sure that you're getting aerobic exercise most days of the week, at least 30 minutes of aerobic exercise. A big thing in our society is diet. So we have terrible diets. So watching the amounts of processed foods, which is huge, fast foods, processed foods, saturated fats, animal fats in your diet, making sure that we're eliminating those as much as possible, trying to eat significantly more amounts of fruits and vegetables, leaner meats like chicken and fish, and the healthy fats like avocados, olive oil, things like that. Making sure that, our diabetes is well controlled, our blood pressures are well controlled, and our cholesterol is well controlled. Another scan that we sometimes will do in patients when we're trying to figure out what is their actual cardiovascular risk is called a coronary calcium score. And so if I have patients who, have a strong family history or, they want to know how aggressive we need to be with their cholesterol management, things like that, we'll send them for a calcium score. And what that will tell us is if there is any amount of coronary disease, because over time, the plaque in the heart arteries will turn to calcium. So if we see calcium, then it gives us an idea like, hey, you already have some stuff going on. Let's get really aggressive with your risk factors.
When you're talking about risk factors, can't control your genetics, but you can control, diet, exercise, and quitting smoking or not picking it up to begin with. When it comes to exercise, you say 30 minutes of exercise. What kind of exercise you talk about? Do you need to go out and play one-on-one basketball, just take the dog for a walk? What kind of exercise level are we talking about here?
I mean, honestly, it depends on where you currently are in your life. If you're a couch potato, then yes, just get out and walk. Just start doing something, move. But ideally, we're looking at at least 30 minutes, like I said, most days of the week of aerobic exercise. So something that is going to get your heart rate up and sustain it up, such as biking, walking vigorously, running, swimming, that kind of stuff. I also am a big proponent of weightlifting, especially for my older population. If you add in some strength training into your regimen as well, that will help you keep your independence as you get older. But basically, for your cardiovascular health, we recommend at least 30 minutes of aerobic exercise most days of the week.
Well, you've caught my attention there. You recommend actually lifting weights for older individuals. I would have guessed younger folks would be more interested in getting in the weight room. Why get to the weight room if you're getting up there in years a little bit?
As we get older, our muscle mass decreases, and if you're doing something to maintain your muscle mass or even get stronger, you're less likely to become frail and be able to stay living on your own. Basically, you want to be able to get out of your chair when you're older and walk to the bathroom. Or, if your muscle mass is declining and you're not doing anything to maintain that, then you will eventually lose your independence.
Okay, now that makes sense. You don't have to train like you're going to be playing linebacker for the Steelers, just to keep that independent lifestyle. And I I want to keep that. I would imagine everybody wants to keep that as long as possible. What are some signs that you may have something that is off kilter with when it comes to your heart and you need to go see a doctor? What are some things people need to look out for?
Obviously, the main thing that most people see on TV, chest discomfort that radiates to your left arm up into your jaw, associated with sweating or shortness of breath. That's the, usual symptom. Other people will have just the shortness of breath with exertion, or just the jaw pain, just the left shoulder pain. Some people will just have nausea. So things that seem out of ordinary, most of the time, these symptoms are also going to come on with exertion before they come on at rest. So if you're starting to notice, hey, I used to be able to climb 3 flights of stairs, and now I can only do 2 before I have to stop and take a break, or now I can only do 2 before I get chest discomfort, or I used to be able to mow my lawn, and now I have to take frequent breaks. Those kind of things make you think, hey, there might be something going on, and maybe you should get checked out.
How do you know, this is going to sound like a silly question, but I'm going to ask it anyway. How do you know the difference between you're getting older, maybe you're just not in as good a shape as you used to be, and something's needs checked out there? Does that make sense to you, Doc?
It does, and I get that question a lot. And I actually get patients who just say, oh, well, I'm just getting older, so I think that's what it is. Mm-hmm. And they might be right, but there might also be something going on. And so that's when, doing some of these testing that we're talking about becomes beneficial. So, if I have somebody who has a lot of risk factors and they're telling me, hey, I get short of breath, but I'm also getting older, I think it's, probably just I'm not doing what I need to do. A quick CT scan to look at their heart and an echo to look at their heart valves, things like that. You can say, you know what, you're good. Let's start an exercise program. But I do get that question a lot.
All right. Well, then maybe it wasn't as silly as the question I thought it was. Then some of the things I think of when I'm sitting here talking to you all, go, I don't know if that one makes sense or not. Got about a minute left. What do you want people to just take away from our conversation today?
Basically, just know that, there are multiple options out there to take a look at your heart health and to kind of keep an eye on any symptoms that you might be having that you need to discuss with your doctor, and ways to improve your heart health as you get older.
Dr. Samantha Crites, cardiac imaging and cardiology. Of course, you can always get more information. Head over to the Mon Health website, monhealth.com/heart. Dr. Crites, thanks for joining us this morning. Appreciate the time, and we'll have you back very soon.
All right. Thank you very much.
Coming up, we've got top of the hour. We've got the Fox News update, local news, and the Metro News AccuWeather forecast straight ahead here on the Voice of Morgantown, WAJR.